This is a virtual lightning talk for the 2016 Health, Wellness, and Society Conference. My name is Dr. Jenny Langham, and I'd like to share with you today, around the world in half a day, the impact of a global health immersion activity on baccalaureate nursing students. During a population-based healthcare course, senior nursing students participate in an immersion clinical activity at the Southern Institute for Appropriate Technology, or SIFAT, in Lineville, Alabama. SIFAT is an organization that hosts groups of people, including leaders from over 80 countries throughout the world, in order to train them in appropriate technologies to take back to their respective countries in order to teach their people healthier ways of living. I've used this transformational learning activity for several years for the reasons listed here on the slide, primarily to teach my students about the significance of community education. It's a hands-on opportunity for them to experience education in order to promote healthy living, so that disease and illness can be prevented, especially among those in need. Our first stop at SIFAT is the urban slum area, where a scavenger hunt occurs. An educated guide from SIFAT actually takes students through it to point out the significant issues that are noted here on the slide. The next few slides will be actual photographs that students have taken from the urban slum area. The next slides show photographs from the Global Village Tour, where SIFAT has recreated realistic dwellings of countries, typical dwellings of countries throughout the world. Community mapping occurs where the students actually draw maps of what makes communities healthy. And they learn about water purification techniques that are taught to other leaders from countries to take back to ensure that their populations have healthy water to drink. The SIFAT gardens teach students about sustainable agriculture, how to farm in just about anything, including rubber tires, what leaves are safe to be ground up into powder to be used as nutritional supplements for those poorer populations who lack nutritional food. Students learn that appropriate technology does not necessarily mean a smartphone or a laptop, but rather could be something as simple as the way they cook their food and prepare it. They also learn a technique to make bricks that actually produce less smoke and therefore help reduce respiratory issues often suffered by those living in vulnerable populations. When students enter the cafeteria for lunch, they have to choose a poker chip from a bag, either a white, blue, or red poker chip. Unbeknownst to them, these represent the percentages of people throughout the world that go hungry. 55% of the world goes hungry every day, 30% get barely enough food for one day, and 15% of the world has so much food that they get to choose what they eat based on taste. I really wanted to find out if this simulation was making a difference as well as its perceived value among the nursing students. So a research study was conducted to gain an understanding of their lived experience of SIFAT and also to determine their perceived impact of SIFAT on their future nursing practice. The next few slides show the actual survey items and the information they assessed. Data analysis is still ongoing, including a qualitative analysis of the reflective question responses, but the initial results are positive and suggest that SIFAT is a clinical experience that makes an impact on BSN students and their future nursing practice. Not all students have opportunities to study abroad, but extreme poverty, hunger, homelessness, and malnutrition occur within the United States, not just in third world countries. It's vital that healthcare providers be knowledgeable of and sensitive to the unique needs
vulnerable populations. Thank you for listening today.